Hi, hello, welcome back. So, today we are again with a series of interview questions which is related to UAE guidelines for medical coders. So, those who are watching it for the first time, hereby I'll add the iCard so that you can check the previous questions also. And today's question, which we are going to discuss here, is can you explain the importance of accurate sequencing in ICD-10-CM coding? So, I'll explain you like the question can be in this way or in some other way also they can ask you about this. Like, what is accurate sequencing of ICD-10-CM? Like, what is the importance of accurate sequencing? So, accurate sequencing in ICD-10-CM coding is crucial because it ensures that the correct order of diagnosis code reflects the patient's primary condition as well as any related secondary condition that influence the treatment and care. So, for correct coding, we should know the guidelines, then only we can assign the primary code properly. So, first thing is identify the primary reason for encounter. So, while reading the documentation, you should read it twice and check for what condition the patient is coming to the hospital. Based on that, you have to relate the guidelines, ICD-10-CM guidelines, and you have to check which condition can be given as a primary code. Second comes impact, reimbursement and billing. So in this case, medical coders directly influence how healthcare providers get reimbursed by insurance company. The first code, that is a primary diagnosis, always should be correct. Incorrect sequencing results in denial claims, underpayment or overpayment. Third comes accurately reflects the patient's clinical picture. Proper sequencing gives a comprehensive view of patient's health status, helping healthcare providers understand which condition were prioritized for treatment during the visit. Secondary condition and complications can be arranged accordingly, but the primary code should always be focused on the guideline. Fourth comes prevents misleading information. Incorrect sequencing can lead to misinterpretation of the patient condition. For instance, if a chronic condition such as diabetes is improperly sequenced after an unrelated acute condition, that will result in denial, okay, or rejection. And the fifth one comes ensure compliance with coding guidelines. ICD-10-CM is governed by strict sequencing guideline established by coding authorities such as CMS and WHO. Following these guidelines ensure that the coders are compliant with coding standards, reducing the risk of coding errors and audits. And sixth comes the captures complication and other condition. So proper sequencing allows for comorbidities or complication to be documented after the primary diagnosis. Usually, after the primary diagnosis will be given more importance and the complication related conditions, everything should be coded. Second code as a third code. Okay. And seventh comes improves data collection for healthcare analytics. Accurate sequencing plays a role in data reporting and analysis. Health authorities and public health organizations such as DHA or HART rely on correct coding data to track health trends, allocate resources and monitor disease prevalence in the population. Eighth comes minimizes audits and legal risk. Proper sequencing helps ensure legal compliance by aligning the code with clinical documentation. Incorrect sequencing might trigger the payer audits or investigations into fraudulent billing practices, leading to potential penalties or legal issues. So that's all about. These are the importance of accurate coding in ICD-10-CM. So accurate sequencing of this code, mainly the primary diagnosis should be coded based on the guideline. Proper alignment of the code is very much essential to avoid the denial of the claims. Okay, so that's all about this topic. Thank you so much for watching. If you haven't subscribed, please do subscribe. And if you find it useful, please do share it with your friends also. Thank you so much. Wish you all the best for your interview. Take care. Bye bye.